We're going to talk about face, eyes, nose, and mouth injuries. So obviously our objectives is to learn how to identify face, eye, and mouth injuries and learn how to provide appropriate care for those injuries. Quick anatomy, not a lot. We already talked about the skull anatomy in another lecture. So our face bones are the maxilla, which is our upper part of our face above our teeth. The mandible, which is our jaw, and the zygomatic is our cheek. So now let's start talking about injuries to our face area. So fake or scalp lacerations. Again, the scalp's what covers our head. So we can cut our face with a direct blow with the elbow, puck, ball, etc. Get hit by something. Signs and symptoms, something like this. You have a laceration on the chin or wherever on your face. It's going to bleed a lot on the head, on your face, because there's just a lot of blood flow there, a lot of capillaries. So there's going to be a lot of bleeding. The injury may not actually be that bad. It just looks bad because of all the blood. May have some swelling. So how do you think we should treat this? How do we take care of bleeding? Well, that may be a test question. How do we know when we need to send something to get stitches or sutures? Is if in that picture right there, that person needs stitches because the skin is not touching one another when it's just lying there. So we need to have stitches to put the skin back together. So anytime the skin does not touch after we clean it up, that's when we know a person needs stitches. Eye contusion, also known as a black eye, caused by a direct blow, elbow, hand, head to head, those type of things. Sign symptom really, really bad is pulling in the eye. I've never seen anything this bad, but that's one thing that could happen. They may not be able to move their eye up, down, side and around. Their pupils may be different sizes or shapes. Inability to open the eye because of the swelling. They may have some vision changes, double vision, blurry vision, those type of things. So our treatment here is if the athlete has blind spots, double vision, blurred vision, perception of flashing lights, or blood in the eye, we need to call 911 and get them transported ASAP because they may have something going on in their eye that is beyond our care. While waiting for the EMTs, apply an eye patch over both eyes, even though in the picture I only show one eye. You want to do it over both eyes because you don't want the eye to move all over the place because that's just a natural reaction is you're going to look and you're going to move the injured eye too. So you want to cover both eyes. Eye abrasion. This is a scratch or a cut to the clear part of the eye known as the cornea. So it can abrase it or lacerate it. This can happen from dirt or sand in the eye, fingernail to the eye. Typical sign and symptom here is pain, vision impairment, distortion of the corneal surface is observable, which I have in a picture here. These are extreme examples, but the pupil may appear tear-shaped. Treatment here is don't rub the eye as much as you want to. Don't rub the eye. Don't remove the object. Do not remove the contacts. Do not use eye wash. Patch both eyes and get them to the ER because somebody else more qualified than us needs to take care of them. So fracture to the eye socket, that's the bone around the eye. So it's a fracture. This happens with a direct blow like a ball to the eye. Happens a lot in baseball and softball. So our signs and symptoms, the main sign for this one is inability to look up. So you can see on this picture is that one eye the person can look up and the other one they can't look up. You have to do it both at the same time. So that's the main sign and symptom for a fracture to the eye socket. They can have vision problems, They're going to have pain and swelling at point tenderness at the eye socket and bleeding. Could possibly have bleeding in the eye that we showed in that one picture earlier. They can also have deformity around their eye socket. Can't really see it in that picture, but it can be lower. It can look like it's set in. So our treatment here is call 911 and patch both eyes. Again, a lot of the eye injuries are for the hospital. Bloody nose. This is an older picture of Steve Nash with probably had a fractured nose, but it's also very bloody. So we want the person to lean forward, apply pressure at the area where your nose becomes soft. You know, you got the bony nose there and the nasal bone, right? Between the nose and where it becomes soft. You want to apply pressure there with both fingers. We can put gauze, or there's also nose plugs in the nostrils. We discourage the person from blowing the nose because that'll cause them to bleed more. If the bleeding does not stop within 20 minutes, they probably got a fracture, and it's beyond what we can do for them. So let's talk about the nose fracture. This guy's probably had his nose fractured at least once, as you can see by the deformity. So signs, symptoms, pain, swelling, point tenderness. They're going to have deformity like this guy's nose. Bleeding, obviously. Discoloration. Treatment, same thing with the bloody nose. If we can't get it to control the bleeding, we're going to have to send it to the ER. Facial fracture, we can fracture the cheek, the jaw, or mid-face. Obviously, a direct blow, getting hit hard by something, a fist, a puck, a ball, a foot. Signs, symptoms, pain, swelling, point tenderness, inability to bite down normally. Teeth don't line up correctly. They can have abnormal sensation in their face or their cheeks, bleeding at the mouth. They can have vision problems. And our treatment here is 911 if it's really, really bad, which is most of the time I would just go ahead and call 911. If not experiencing shock or severe bleeding, splint, ice, and take to ER. This is how you do a facial splint. With this, again, I'd probably just have them go to ER via an ambulance. Dislocated teeth, partially or completely dislocated, is knocked out of socket by a direct blow. Treatment here is placed. There's a thing called a tooth saver that most athletic trainers have in their medical bag. You can also place it in a container of milk or saline solution. You need to control the bleeding. You need to get to that dentist ASAP. That's why most teams, college and pros and high school teams, have a team doctor that they're on call to take care of these type of things. The tooth doesn't last that long, so you have to get them there as soon as possible because the tooth would die, and there's nothing they can do with it. Most of the time, to get a tooth knocked out or chipped like this, there's not much the dentist really can do for it. With this, my daughter at 2 had this happen to her. You typically have sensitivity to cold or hot, air pressure. Got to lean forward, control that bleeding, and get them to the dentist to see if there's anything they can do for the tooth. Most of the time, they can't. Eventually, you have to remove the tooth and put in a new fake tooth. Cauliflower ear, also an ear contusion. This happens a lot in wrestling because their ear is on the mat a lot, so they're constantly rubbing their ear on the mat, and they get this deformity in their ear. That's cauliflower ear. That's what it looks like. I don't know why it came up with the name cauliflower. I guess it looks like cauliflower. Not much we can do for it. We treatment, you ice it, and I've seen some kind of advanced care for it, but I don't think it really worked. The athletes should wear headgear, but for whatever reason, wrestlers don't like wearing headgear because it's not cool. As a review, we talked about the face bones, face and nose lacerations and fractures, eye injuries, teeth injuries, and ear conditions.